back in 2019, I saw an article in the Abilene paper about the Kansas Silver Haired Legislature, and I had heard of it off and on over my life, but not really, didn't know exactly what it did. So they were looking for a Dickinson County representative, and so I got the 50 signatures and became one, and so now I are one. This is my second year of my first term, and hope to continue with that. I'm the Dickinson County representative. I was also elected chair of the PSA 8, which is North Central Kansas, North Central Flint Hills Area Agency on Aging is our group. 18 counties there, and I also was elected as first vice president of the statewide organization. So it's kind of what when I got started in Silver Haired, I went back and looked at some of their background. They've been around. You're probably familiar with them. Worked with Don, I would guess. Been around since 1982 and do a lot of things for seniors. Try and keep the legislature honest on senior issues.
Will you tell us what data, you've been sending me data every week, but will you tell me how you got started tracking COVID data and why, and what you're publishing and to whom on a weekly basis?
Basically, when COVID first, was in the news and everything, they were talking about how it affected seniors and older folks with pre-existing conditions and things like that. And so that was basically my primary interest, to see if that was really the case or not in Kansas. And it kind of fell out of the news after that. You don't really hear a lot about that anymore. And so back in, I think the 19th of May was the first one of these that I had sent out. And essentially what I wanted to do is to kind of track the pandemic in Kansas and see what its effects are, and seniors are being affected diversely compared to the other population groups. And so that's kind of how I got started in it. It is basically something that I do on my own. I'm not a trained statistician. I have a pretty good analytical mind, I think, and from other jobs that I've had, and I like to look at things maybe a little abstractly, but basically to try and paw down through the numbers and see if you can make sense out of them, because you get, I don't know, I guess data blindness, for lack of a better term, is probably a technical term for it. When you look at stuff for so long and all just as numbers, it doesn't seem to have any application or pertinence to you individually. So I started doing it just to kind of see what was happening to seniors in Kansas with this thing, and sent it out to the Silver Haired Executive Board and PSA members. And then over time, I've added a few other folks to it. It's my analysis of what's been presented by KDHE, and the caveat is that's what it is. I use their data and look at it and massage it a little bit, and don't alter it other than to recategorize some of it into areas that, or into groups that I think are more meaningful for seniors. And
so as you've been looking at the data, we've had some particular concerns about the fact that the data doesn't tell us anything about nursing facilities or assisted living facilities or other adult care facilities where there are outbreaks. What do you think about the kind of data that KDH&E is providing right now, and what else would you like to see that you think would help inform the conversation for policymakers and for silver-haired legislators and area agencies on aging and others of us who are interested in aging issues?
It is difficult. They're taking, I think they take a broad brush approach, although recently they made some changes to their website where they do have clusters, and they are showing that like 118 of the deaths have been related to long-term care facilities. So they have made some modifications in how they represent it, but it's hard in a statewide program because there's so many variables and interests of different people and groups for them to come up with a good way to make everybody happy. So yeah, one thing that I would like to see is that we have, essentially they give their age categories for the number of cases, deaths and hospitalizations, so you can look at the groups that way, but they don't have at the county level, they don't have hospitalizations and deaths. And I'm sure that's harder for them to track, but I know, they do at the county level track the number of cases that have been reported. But it would be helpful for me, to be able to look at where the deaths are occurring if we have particular counties, and like, for example, in PSA 8 that are having higher incidence, why that is.
So one of the things that you're doing a great job is illustrating how data and information can help us in tracking policy issues at the big picture level, but also what impact that has on individual Kansans, and specifically those who are older. So great way to illustrate that. Thank you.
Thank you. Well, the other thing, I don't know if the thing I sent out last week, I tried to make it, because there's numbers are so big and it's hard to make sense out of them. So I tried to do some, like as far as the total number of tests that have been issued, it's basically only 60% of Wichita's population, or 70% of Wichita's population. And the number of cases is about the size of Emporia. So, essentially the whole town of Emporia. So it's, I try and make it so that it's helpful for people, or gives them something they can look at to grasp what we're really talking about.
So what you're saying is, in the entire state of Kansas, the number of tests that have been given have been 60 to 70% of the population of the size of Wichita.
That's based on the numbers that they presented last Friday. That's kind of what it was showing.
And the number of positive cases would be something akin to the size of Emporia for the whole state of Kansas.
Correct.
Yeah, I think that's really helpful.
Okay, well, essentially, I look at cases from a couple different ways: the total number of cases, the number of hospitalizations, and the number of deaths. And so this first set of pie charts is this one. Can you see my cursor?
I can, and it looks like you're starting on the 1st of May with that first one.
Well, this would be June 1st.
Oh, June 1st. Sorry, thank you.
Back in June 1st, we had 10,011 cases on that date. The gray, and I don't know why it picked gray, but Excel says gray that's what it used for 65 and older, so I guess that's appropriate.
It's the color of our hair, Rob.
Right, that's right. So at that time, seniors were about almost 12% of the total cases in Kansas, which is not a real high number. The blue category is what I took. They have it by 10-year increments, and I broke it into essentially what I would consider college age and below, working age, and retired or seniors. And so I take all the KDHE categories and bring them down condense them down into 3 categories. To me, it's a little easier to see or understand. So the 18.52%, those are the number of, back in June, of all the cases that had been reported. That was the percentage that was in the 0 to 24 age group. 69.4% was the 25 to 64 age group, and then the gray area is about 12%, which is the old folks. And I just wanted to look at over time to see how the distribution of the cases is changing. And if seniors have remained fairly constant, if you look at the second chart, which would be July the 1st of this month, we dropped slightly, about 1% to about 11% of the cases were seniors. And we've dropped a little bit more as of the 24th. We're down to 10 and 10.35% of all the cases that have been reported to date. And so you can see that the younger folks are really picking up the cases, because they've jumped from 18.5% up to 27% of all the cases that have been reported.
I think one of the things that it's really important to notice about that, it took me a minute because I was looking at the percentages, is that on the 1st of June, we're looking at 10,000 cases, and on the 24th of July, we're looking at 25,000 cases.
Correct.
So even though the percentage of population that older adults represent with cases is down a little bit, the reality is the numbers are higher.
Correct. That is correct. And so then the next row is the hospitalizations, and this is where my concern for seniors really starts to stand out. So on June 1st, we were about 44, a little over 44% of the hospitalizations were people 65 and older. And then that drops because the other two age groups are kind of catching up. Mostly it's the 25 to 64 are getting more hospitalized. So they're becoming, I guess my interpretation would be that they're becoming sicker now than they were earlier on. And so they moved from 52 to 55 and dropped just a hair down to 54%. But the senior hospitalizations have dropped from 44%, we're down to 40.5%. But there again, we went from 862 to 1596. So the distribution's staying about the same for our seniors, but it's the thing. And then the final one is deaths. The 0 to 24 has not had any fatalities as of the 24th, which is good. But if you look at the death rate or death percentages, seniors by far, 78%, and we're still in the 78.5% range now. So if you look at the gray bars on this, what this is, if you look at just total numbers, we're not, seniors 65 plus are not a large number of cases. We're about, I think we're actually about 15% of the state's population based on the census data that I looked at, their estimate for 2019. So we're about 10.3% of the cases last Friday. But of the people that get hospitalized, we're almost 41% of those that get hospitalized. And of all the people that have died, we're 78% of those. So the point I try to make in my emails is that you don't want to get this stuff if you're 65 or older. And if you look at the data, if you look at it across the senior spectrum, it's basically what it tells me is if you're 65 and older and you get COVID-19, you have a 1 in 4 chance of going to the hospital. Of those people that go to the hospital, 40% of them do not leave the hospital alive. So that's looking at if you look at just the senior category.
That's pretty concerning, isn't it?
It's, you have essentially of the number of cases that they've had, 25% of those that are 65 and older go to the hospital. Of the ones that go to the hospital, 40% of the people that go to the hospital that are 65 and older do not come out alive. And which is, as you know, doubly devastating because nobody could be there with them.
I just really appreciate that you are doing this and sharing it with us. And I really appreciate that you're willing to come and talk about it so that we can share it and the intelligence behind it with others. Because I think it is really important information for all of us to have, and certainly for policymakers to have.
Well, thank you. Like I said, I just started out as kind of I'm interested in doing it. And if other people can get some use out of it, that's great, because that's what we need to do. There's so much stuff out there. Nobody seems to trust anything anymore. And I can tell you that this is, I'm as objective as I can with what the data is showing. I just, I don't have any contacts in KDHE. I just take their data and take it at face value and try to make sense out of it.
Well, I appreciate you making sense out of it for us. So thanks so much for doing this today.
Sure.